Taking a look at these pictures on V-Day. The first Canadians will be being vaccinated today against the coronavirus. Just keep that in mind. The second country in the Western world to use a coronavirus vaccine, the second country to use the Pfizer-BioNTech vaccine. Less than 24 hours after the first doses arrived here, you're seeing the first shipment landing last night, just before 8 p.m. at Mirabel Airport outside Montreal. We are hearing now that the federal health minister, Patty Hajdu, will be in Montreal to someone get that first dose. She's going to witness it herself. If she's in Montreal, that means that she's going to be at Maimonides, the geriatric center, because that's where we were just speaking, and we know that they are waiting their shipment. More shipments are coming into Canada today by plane or in trucks, and 30,000 doses are expected this week, as many as 249,000 by the end of the year. These pictures from Ontario, the vaccine going to 14 different access sites across the country, just in the provinces so far, not up into the territories yet. This video from the Department of National Defence, the Combat Camera Unit, showing us the first shipment into Ontario. These are doses being offloaded at Hamilton Airport, and the Premier was in attendance for that moment. This is the start of the biggest mass inoculation program ever in Canada. Vaccinations from British Columbia to Newfoundland and Labrador set to begin as soon as possible. What's in store for Ontario? Let's find out. Retired General Rick Hillier heads Ontario's vaccine distribution task force, just off a plane, just beginning a series of very important duties today, but we're very thankful he's giving us some time. Sir, welcome to our program.
Heather, thank you.
I just want to begin with the moment. I just mentioned the biggest mass vaccination program this country's ever seen, and here it is upon us. What's your sense of occasion, sir?
Heather, like you mentioned it, V-Day. This is V-Day, and the number of vaccinations that will take place today are probably pretty small. But, you know, I think there's a little sort of trickle down the spine of every single person in the province here and in the public service and in the health sector who've been working this issue for months, who've been fighting COVID-19 and, you know, trying to keep the spread down and keep people alive. And maybe, you know, this is not the light at the end of the tunnel, but it's kind of somebody lighting a match to light a light and help us see our way out of the abyss and the darkness we've had over this past almost a year now. So my goodness, this is exciting. This is what we wanted. And, you know, there are all kinds of challenges and problems we're going to face with them, with this. And that's exactly what we want. We want those problems and challenges because it means we're on the way out of the abyss. This is an incredible day.
So getting these smaller, comparatively small number of doses in to work out further some of those kinks that you've already tackled with the dry runs, this is what you'll be expecting today. What are the challenges and perhaps snags that you anticipate as the doses arrive in Ontario today?
Heather, I wouldn't even begin to predict the snags. You know, but every part of this is a challenge, making sure we handle the vaccine in the appropriate manner. I've been to both sites which are starting vaccinating either today or tomorrow morning, and I was just so impressed with those medical professionals and the discipline and the professionalism and the knowledge-based work that they've done to lay out the flow of the vaccine, where it goes, how it goes into a sterile site to be thawed and then diluted and then moved in syringes only forward to the vaccination sites, how people are separated. How we communicate with people that we want to come forward are clearly in the top priority of those in most vulnerable circumstances and healthcare workers, particularly at the front end, healthcare workers who work with those in more vulnerable circumstances. Yes. That is a huge challenge for us. What we're getting around all of those things, we've asked both the University Health Network and Ottawa Hospital, who are launching here today and tomorrow, we've asked them to do a bit of a playbook for us and come back by, you know, later this week and tell us what they did, what went right, what went wrong, and what they did to fix it. And then we want to distribute that and talk to all of the other sites that are going to get the next doses in. And then we'll learn from that and build to a vast immunization program across Ontario. So we're learning as we go, for sure.
Have the doses arrived, both at those two sites you mentioned, University Health Network in Toronto and the Ottawa Hospital? Have the doses arrived yet, to your knowledge?
At one site, University Health Network, yes.
Okay, so
I'm
they're
not sure
Toronto.
about the other. I'm not sure if they're there yet or not, and I'll know that in a few moments.
Okay, and if they have arrived on site, does that mean that the vaccination program will begin today?
It's going to begin today here at the University Health Network for a small number, just like we want to use those 2 sites to sort of proof the first part of the system. Then each of those sites want to have a few people to vaccinate to proof their program and proof what they've set up and make sure they're ready to go ahead for larger numbers in the next couple of days. So we'll start here for sure, probably tomorrow in Ottawa.
So that's interesting. That's a bit ahead of schedule. I think it was planned for tomorrow in Ontario.
You know, we said right from the start here, we were never sure when the vaccines were going to arrive. That's been really tough to actually determine. And what we wanted to be simply was ready when they did. We don't want to waste any time here. And that's clearly what's happening. Again, I just got to give kudos to the incredible people in the medical profession here in Ontario. My goodness, we hold them in a huge debt of thanks and gratitude for what they do. They're all tired. You know that. They've been fighting this horrible virus for the last 10 months here, trying to keep people alive, keep our families together, stop the spread. And now they're getting inspired also by the opportunity to have this vaccine and help them do their job. They're incredible, and they're doing it.
Let me ask, there's a difference in terms of how Quebec is approaching the doses and how Ontario is. Ontario, as I understand it, you're giving half, whatever the approximate 4,000 coming in, you're giving half of that for the first dose and then putting the rest in storage for the time when those same recipients need the second dose for maximum effectiveness. Quebec, as I understand it, is using all of its doses and hoping that there's enough shipment in time to give those same people their second dose. So there is a different strategy here. Why do you think Ontario's is the way to go? Wouldn't you be wanting to get more vaccine into more arms, is what I'm wondering.
Yeah, and we want to get vaccine into more arms as soon as possible, but we also want to do it right. And the vaccination program is not 1 dose, it's 2. And so, you know, we've been uncertain about the delivery schedule of the vaccines, and it really has been difficult to nail down. And I think you just hit the nail on the head when you said they're going to hope that the second vaccine is available. Well, somebody wrote a book one time called Hope is Not a Method, and that's not how we're going to operate. We want to ensure that we're going to vaccinate 1,000 people. We're going to have the second vaccination for day 21 available for them before we do the first. And that way, if there's any interruption in the supply, if the vaccines don't show, and we have no dates whatsoever on when the next ones will show, then we will not have wasted the first ones. We'll have the second one ready to go. As we get into the program and more vaccines show up in greater numbers of doses, we may change that, obviously, because we'll have confidence in the supply chain and the fact that it will work regularly, and we'll always get doses to do the second one. But right now, slightly safe rather than sorry. We want to make sure the vaccines are effective. And to do that, you do need the 2 vaccines, and we want to be able to guarantee people, you're coming now to get vaccinated tomorrow. When that appointment is made, you're getting an appointment for 21 days or so from now, and we want to make sure that vaccine is there. And this is the only way we can be certain.
Thank you so much for the time today, and I'm very happy that you're able to make some time on what I know is going to be a day of great significance for you and a lot of work. So, Retired General Rick Hillier, who heads Ontario's Vaccine Distribution Task Force, again, thank you. We will be watching very closely, and I hope we can talk again as we see how this all goes. Thank you, sir.
Heather, thank you.